The heart sits in the thoracic cavity obliquely from the third to fifth intercostal space. 1/3 of the heart sits to the right of the mediastinum, 2/3 sits on the left. The 4 valves of the heart are projected onto the thoracic wall, with the aortic valve at the third intercostal space, the pulmonary valve at the third rib costal cartilage, the tricuspid valve under the sternum at the fourth to fifth intercostal space, and the mitral valve at the fourth costal cartilage. These dots indicate where the heart sounds can be auscultated. Please note that these auscultation sites differ from the actual location of the valve. The wall of the left atrium consists of smooth muscle formed by the absorption of the embryonic pulmonary veins. A small sulcus is present from the healed foramen ovale. The left ventricle has a muscular wall. The aortic valve sits inferior and medial to the mitral valve. Adult blood flow through the heart starts with oxygenated blood coming in the pulmonary veins, dumping into the left atrium. During ventricular diastole, high-pressure blood is moved from the left atrium to the left ventricle through the mitral valve. And then during ventricular systole, the blood is pushed through the aortic semilunar valve into the aorta. Fetal blood flow differs due to the development of the liver and the lungs. Oxygenated maternal blood comes in via the vena cava into the right atrium. From here, the majority of the blood is shunted directly to the left atrium via the foramen ovale. A small amount of blood does enter the right ventricle and come into the pulmonary trunk. However, since the lungs are not developed, it moves into the aorta via the ductus arteriosus. The ductus arteriosus and the foramen ovale both seal after birth.